mind confirming your first and last name? All right, it looks like you are right on time. It looks like today we are going to be doing just your routine annual exam and Papsmear. Does that sound about right? Awesome. So I am just going to go through everything that we have in the system. Have you had any changes to your pharmacy on file at all, or primary number? Where would you like it to go instead? Alrighty, very good. And then have you had any changes at all to the medications that you've been taking? It looks like you're not actively taking any. Would that be fair? Okay. All right. Any new medical conditions that you've been diagnosed with since we last saw you? No? Okay. Just want to make sure. Any new surgeries at all? Do you smoke or drink? Anyone in the family newly diagnosed with breast, ovarian, uterine, or colon cancer? Okay. And any changes in your sexual history at all? Still in a relationship with a male partner? Okay. Doesn't look like you've had any history of an abnormal pap smear. Let's see, last one was about 3 years ago. Did you want us to screen you for any sexually transmitted infections while you're here today? Okay, no problem at all. So we will do a swab for that, but you're not having any burning, abnormal vaginal discharge, odor, or itchiness, right? None at all? Okay, just want to make sure. And when was the first day of your last menstrual period? Okay, gotcha. All right, well, let me get a chart started here for you. So we're here for your routine annual exam. You did want some STI screening. Now I should ask you, do you want blood work as well with the screening, or just the swab while we're there? You think you got blood work at primary? Okay, so just the swab. All right. And then of course for the annual exam, we will be doing a breast, abdominal, and pelvic exam with Papsmear. Are you okay with all 3 of those components today? All right, excellent. So we are gonna start with your vital signs, of course. Let me just put some hand sanitizer on. But how have you been? Good, good. I love to hear that. Yes, today is a good day so far. Kind of taking it easy. Nice calming Wednesday. All right, if you wouldn't mind slipping this through your arm. There you go. And I am just going to take a quick listen here. Give me 1 sec. Good. I am just going to take this off of your arm. There you go. All right, blood pressure is normal. How has your family been? Everyone going through it okay? Good. Good, good. That's awesome. All right, let's just rate your blood pressure here. Okay. And then we'll do our temperature check. this is going to go right underneath your tongue. Very good. Temperature is within normal limits, so that is awesome. Let me just write this down. All right, and then how tall are you again? And do you know roughly how much you weigh? Okay, thank you very much. Before you get undressed from down below, we are just going to collect a urine sample in case we may need it later on. So I wrote your name at the bottom of this, and I will leave this here for you. You can leave it by the bathroom counter, and I'll just hold on to it in case Leanna the PA needs it for anything. So for your annual examination today, some of the equipment that will be used will be a speculum for the pelvic exam. I have brought out the Papsmear specimen container with the brushes to collect your pap, and then the swab for the STI screening for you as well. And then of course we have Sally the speculum for you to squeeze onto if you need to. Leanna the PA is going to need some gloves as well, of course, so I will get that set up here. And then I left a drape over here. You'll just take this drape. You can keep your shirt on, but you'll take off your bra underneath. And if you wouldn't mind getting undressed waist down, you can keep your socks on, and then you could cover your waist with this drape over here. Just try not to wrap yourself like a burrito. And then she will be in to do your breast, abdominal, pelvic exam, and pap smear, which would conclude your full annual exam at the OBGYN, okay? No problem at all. So I'm going to go take this chart to Leanna the PA, and then she will be in to take care of you. Absolutely. It's nice seeing you. Hello. It's very nice to see you. My name is Leanna. I'm a PA that will be doing your full annual exam today. Do you have any questions at all before we get started on the exam? Okay, and just to confirm, it looks like you're due for your pap smear this year, and you also wanted some STI screening, but the swab only, no blood work, right? Awesome. All right, let me put your chart away here. How have you been? Good, good. I am so happy to hear that your year has been good overall. That's what we want to hear. Absolutely. I'm just going to grab some gloves here. So we are going to start with the breast exam, if that is okay with you. Okay. And have you noticed any breast concerns at all? No? Okay. So we will start on this side here. I'm just going to lift this a little bit. Just going to kind of press and make sure I don't feel any lumps or anything. In the skin assessment, everything is good. You haven't noticed any skin changes? Good. Do you mind lifting this arm here real quick? Thank you. And there's no swollen lymph nodes. I'm going to cover this side and we'll make our way to this side. I am just going to lift this side over here. Sorry if my hands are cold, by the way. A little bit more, and again, no skin changes that I see that are super obvious. Okay, do you mind lifting this arm too? Again, I'm not noticing any swollen lymph nodes. That is very good. I'm going to cover this one up. I'm just going to move this over to the side just to press on your belly and take a quick look. No pain when I do that, right? Good. No signs of hernias or anything, which is great. All right, and that's it. I'm just going to press on that belly. All right, so the next part here is I am just going to help situate you for the pelvic exam and Papsmear. So we're just going to move this over, and I'm just going to help you here. There you go. You comfortable like that? Good, good, good. All right. I am going to move this tray over here to the side. I'm going to move you a little bit more, okay? There you go. Awesome. I am going to grab this light just to shine it there. Would you mind scooting down a little bit more to the edge? There you go. I'm going to pull this out here. There you go. So the first part of this exam is I'm actually just going to look on the outside only. So you're going to feel both gloves here on the outside. Just making sure I don't see any suspicious moles or lesions. You haven't noticed any skin changes or irritation though, right? Good. No burning when you pee. You haven't felt new bumps or discomfort when you sit. Very good. And the mole that's here, it's always been there, hasn't changed in size, shape, color, nothing like that. Okay, just want to make sure. All right, so we are ready. The outside assessment is completely normal, so we are going to go ahead and move on to the internal assessment with the speculum here. Of course, we'll start with the smaller size. We'll put some lubricant. All right, so you are going to feel some pressure here, okay? Pressure loop, there you go. All right, I see your cervix perfectly, so that is very good. So we are going to start with the Papsmear first. And we will be using two brushes, the sidle brush and the spatula. All right, you may or may not feel this. All right. And the spatula here. All right, taking that out. And then we're just going to scrub these two brushes together. All right, you've got enough of a good sample there. Papsmear is done. And then we will collect the STI swab now. All right, this is just the size of a Q-tip. All right. The last part is just the internal exam with my glove, okay? Yep, we're gonna put some lubricant here, and this is just gonna help me assess if you have any, you know, enlargements where your ovaries are or your uterus. Okay, gonna feel more pressure. No pain, right? Good. All right, excellent. You are all done with the examination. All right, now, I don't know if you remember, but Papsmears can take a while to come back, sometimes up to 10 to 14 days. If the pap smear is not normal, of course I'll give you a call, but if it's normal, then you'll just get a message from me through your portal saying everything looks good. Same thing with the infection screening, although that should come back definitely within a few days versus a few weeks, okay? Not a problem at all, not a problem. So that would conclude our annual exam. But do you have absolutely any questions for me before I step out? You and your partner may try getting pregnant? Well, that is very exciting. You know, I actually have some prenatal samples here for you that I can give you some. And then you'll definitely want to start taking them now, even before you get pregnant. And then, of course, you come and see us if there's any concerns or if you get that positive pregnancy test. Absolutely, for sure. Let me grab this for you. This is a box of prenatals for you. I will leave that right over there. As always, it was great taking care of you today. If you have any questions or concerns, you can always call the office or just come right back in. Not a problem at all.